even vaccinating the 5 to 11-year-olds. They're already doing it to the 12 plus. Even that won't lead to any bending when it comes to mask. And you heard her say right there, her purported reason is that the evidence shows schools that have had masks in place were 3.5 times less likely to have school outbreaks requiring school closure. You're the only one who's actually taken a look at the studies behind this claim we keep hearing over and over again that masks in schools prevent the spread of COVID. And so to Rochelle Walensky, you say what?
Well, the study she's referring to has a long list of what are called confounders, which are problems with it. And a number, I haven't written about it yet, but a number of experts who I confer with every day, including infectious disease people who really understand how to read these studies. And I also reached out to a number of biostatisticians regarding this study. And it's just not worth it's not worth the weight that they're putting on it, to put it mildly. I won't bore your listeners and viewers getting into the weeds on the study, but I can say 3.5 times is so wildly outside the realm of what you're seeing benefits from other studies regarding masks that, according to one of the infectious disease people I spoke with, they said that instantly set off alarm bells when they saw that. So we can sort of set that aside. I mean, we can cherry pick 20 other places where there were masks in one district and not in the other, and there was no difference noticeable in the benefit. So
the study she's referring to is not trustworthy, but she still throws out the number. She noticeably does not cite the CDC's own study that you were on reporting about earlier and reported in New York Magazine. It was of 90,000 kids in Georgia, which did not show masks help stop the spread of COVID. And so now, even with the vaccination, of, that would be all school-age children. If you've got 5 plus vaccinated and more schools mandating the vax, like we've seen in LA and elsewhere, my own school, for 12 plus, or it's at least 16 plus. I mean, you tell me whether anything is going to make any of these officials, in your view, based on what you've seen, listen to reason.
I mean, what's interesting is I think that the frame about this debate has actually kind of gone off the rails. And, we could debate the nuances and the minutia of one study or another, but I think we're missing the larger point. Even if there was some marginal benefit to be found from masking in schools, the larger question is, to what end? Why? And what I've continually written about and what I spoke about when I testified before Congress is, why aren't we looking at the real world observational evidence from Europe, where it's not 100, it's not that millions of children are not wearing masks in schools. The ECDC, which is the European version of the CDC, recommends against all primary school kids from wearing masks. The World Health Organization has repeatedly said, we don't think anyone under age 6 should be wearing a mask. So those facts alone, it doesn't mean that they're right and we're wrong, but at minimum, I would like the CDC to explain why their guidance differs so dramatically from that of its counterpart in Europe. So this is kind of the broader frame that I think is missing from a lot of the coverage about this, where we're kind of arguing about one study or another. There is not a uniform belief about the value of children wearing masks in schools when you look at Europe versus the United States.
Mm-hmm. Has anybody been forced to answer that? I have yet to see any of these officials pressed on the difference between what they're doing in Europe. I mean, I did it with Scott Gottlieb when he was on my show 10 days ago, but he didn't have a good answer. But Fauci, Rochelle, I'd love to see have you seen that? Anybody pressing them on, are the Europeans insane? Do they not care about children?
Right. So anytime I ever bring this up, the rebuttals tend to either be silence, or it's something on the order of, well, Europe is different than here. Denmark is not America, or this country or that country or the UK. I mean, These are children in schools, and I've done the research, Megyn. I've looked at the vaccination rates, the current case rates, and the overall mortality per capita, and they are all over the map, so to speak. Some are above the US and some are below. So it's not this notion that Europe has, beaten the virus and they've sort of earned the privilege of children not wearing masks in schools. They haven't. The cases, the vaccination rates, and the overall mortality, they're above and below. They're all over the place. The one unifying factor is that they're not having little kids wearing masks. They do have different cutoff ages depending on which country, but they're all in agreement that at least little kids shouldn't be wearing masks. Here in New York, where I live, the new governor put in a policy where kids all the way down to age 2 are wearing masks. I had a call yesterday with a bunch of frantic moms who have children in preschool who are basically apoplectic, saying, we don't know what to do. Please talk to us. We're really worried about our little kids, 2-year-olds, 3-year-olds wearing masks in school. So these are things that even if we set aside and say, hey, maybe the CDC is right, I think as American people, we are owed an explanation, a very clear and cogent explanation why their guidance differs so dramatically from that of their European counterpart,
yes,
the CDC in Europe.
And frankly, not just on masks in children, but on natural immunity too, because over in Europe, they're accounting for that in a way we're not here.
I think one of the most astonishing developments has been this sort of refusal to acknowledge the value of natural immunity. And once again, sort of echoing a bit of the argument about masks, whether or not there may be some marginal benefit of masks kind of is a distraction from the broader point. And similarly, whether there are differing studies, and there's mixed evidence about the duration of natural immunity versus the vaccine-induced immunity. But what we know, this is kind of, infectious disease virology 101. We know that when someone gets infected, there's a long history in most of disease science where we know that that's going to confer some degree of immunity. And there's a fair amount of evidence that the immunity conferred from natural infection is stronger than it is from vaccines. Mm-hmm. There, of course, are also some studies that show something different. But what I'm saying is we keep getting into the weeds of, well, maybe one's a little bit better or not a little bit better. We don't know the duration of the vaccine-induced immunity either. I'm very pro-vaccine for adults. It is that is something that I think makes sense for nearly all adults to do. I'm fully vaccinated. But we need to have a nuanced discussion. Why is it? It's embarrassing that other countries are able to say, we think vaccines are great. Vaccinate all the adults, but let's slow down and take a look at this for kids. Let's offer only 1 dose to children, which some countries are doing. Let's say only kids with underlying conditions should do it, which is what some other countries are suggesting. Why is it that in the US we have only this binary messaging and binary policies from our CDC when there's so much more nuance in other countries? I would like an answer for that.